How can trans youth get parental consent for puberty blockers? Imagine being a young person exploring your gender identity and feeling unsure about how to start medical care. It can be confusing, especially when it comes to puberty blockers. Let's break down how trans youth can get parental consent for this important step. Most minors need a parent or guardian to agree to begin puberty blockers because they are not old enough to make legal medical decisions on their own. The process usually starts with a visit to a healthcare provider experienced in gender-affirming care. The provider will do a detailed assessment to confirm the youth has persistent gender dysphoria, which is distress caused by a mismatch between their assigned sex at birth and their gender identity. They will also check if the youth has started puberty and if they are psychologically and socially ready for treatment. Next, the youth needs to understand what puberty blockers are and what they do. This means they should know that these medications temporarily pause puberty and give them more time to explore their gender identity without irreversible physical changes. The healthcare provider will explain the potential benefits and risks in simple terms. Since most minors cannot legally give consent, a parent or guardian must give permission for the treatment. This involves discussing the treatment plan with the healthcare provider and understanding that puberty blockers are a way to pause puberty for a period of time. The parent or guardian's approval is important because it supports the youth's health and well-being. Family support and open communication are key. When parents are involved, it helps the youth feel supported and safe during this process. It's also important to know that laws about parental consent can vary depending on where you live. Some states or countries have specific rules about gender-affirming care for minors. Families should work with healthcare providers who are familiar with local laws to navigate the process smoothly. In some cases, legal requirements might include a waiting period or specific documentation. Overall, getting parental consent involves a careful process of medical evaluation, understanding, and family support. It's about making sure the youth's health and happiness are prioritized while respecting legal guidelines. This teamwork between the youth, their family, and healthcare providers helps ensure a positive experience with gender-affirming care.